Fastest man in the world, Usain Bolt. 3-time world champion Australian surfer, Mick Fanning. 11-time world champion surfer and regarded as the greatest of all time, Kelly Slater. And 7-time NBA All-Star, Tracy McGrady. What do all these world-class athletes have in common? They all have abnormal curves in their spine, also known as scoliosis, and they have all managed to overcome the challenges associated with this and have risen to the highest level of their respected sports. Scoliosis can have many different effects for every person, due to it being unique for each patient. However, some symptoms commonly associated with the condition include headache, neck, back, hip, knee, and leg pain, radicular nerve pain, and in some cases can contribute to problems with breathing or sleeping. For professional surfers such as Mick Fanning and Leilani McGonigal, scoliosis has required them to try various approaches to overcome these symptoms. For Mick, his condition left him out of surfing and competition due to extreme lower back pain. This obviously had to be overcome some way if Mick wanted to continue his life on the World Surf Tour, hence leading him to begin scouting different treatment approaches to lessen his pains. This led Mick to the first step that should be taken by everyone with the condition, to seek medical advice from a professional. Whether this is a chiropractor or physiotherapist is up to you. Before making a final decision on what treatment you think would be best for you, a professional opinion will help clarify whether or not it may actually be suited for your curve, as some people may need more serious treatments, whereas others may need none at all. Surfing in its modern day form requires use of a range of muscles to perform the many technical maneuvers involved. Calves use the quadriceps, gluteal, and the gastrocnemius. Popping up uses the triceps, biceps, and the deltoids. However, the symptoms associated with scoliosis can actually be worsened by surfing. Lying on the board for prolonged periods of time while paddling causes the lower spine lumbar to be extended, creating strain on the lower back. For people with scoliosis, this may cause their back muscles to seize up and create excruciating pain, as was the case for Mick Fanning. To treat scoliosis, there are 3 main paths that can be taken. The first is a natural approach, also known as a strength and flexibility based approach. This method of treatment relies heavily on commitment and hard work by the patient, as it cannot be successful if not done properly. This treatment option will often be integrated with the other 2 mentioned. However, it can be solely done as well. Yoga and Pilates are the most common form of this method, with both improving on the person's strength and flexibility. These 2 practices are able to give the patient better body and mental awareness, reduce muscle tension, relieve stress, sharpen attention and concentration, and calm and center the nervous system, as well as obviously increasing strength and flexibility. All of these benefits associated are perfect for the sport of surfing, due to the extreme pressure of competition. By having improved attention, greater mental and body awareness, as well as improved strength and flexibility, surfers will be able to achieve more, such as being able to paddle harder for longer periods of time or perform more serious maneuvers. Once Mick began treatment on his back, his chiropractor, Chris Prosser, was getting him to do many stretching and adjustment exercises. Despite his back still in pain, he decided to return to competition and compete in the Quicksilver Pro at Snapper Rocks in Queensland. Mick was taking 2 painkillers before every heat and was struggling with the pain. Despite this, Mick still managed to place second. After this, Chris raised the possibility to Mick about spinal surgery. However, this would mean a minimum of 8 months away from competition and a lot of potential other risk, so he decided to stick to a solely natural approach. He began to work more on strengthening his body, stating, "The most important thing is strengthening your core, so that it takes the brunt of supporting your body. The spine is just like a pole. If it isn't strong, it will just bend in the middle." Strengthening the core muscles is a great way to help remove back pain. It can help by naturally straightening the spine. As the core muscles are the front anchors of the spine, if they are weak, then the back muscles supporting your spine will have to work harder. By developing stronger core muscles, you are hence less likely to endure a strain on your back muscles. Mick also later decided to give yoga a try, which he found an extremely beneficial activity for his scoliosis, making it a ritual to meditate before every heat. After 17 years on the World Surf Tour, Mick Fanning retired in 2018, with 3 world title wins in 2007, 2009, and 2013. Through Mick's persistence and hard work with the natural approach, he has been able to continue surfing at an extremely high level. The second option of treatment is a scoliosis brace. However, this treatment option is only available for children and adolescents. It is a plastic jacket that fits around the torso, from underneath the arms down to the hips. It has straps to keep it in place while the person is wearing it. The goal of the brace is to slow or stop the progression of scoliosis during the main growth years of adolescence, as this is when the spine will curve the most. This is done by retraining your body to maintain a corrective posture. Through stopping progression, further complications associated with scoliosis may be avoided, such as surgery and other symptoms. Bracing is no easy treatment method, and in most cases will need to be worn for 20 plus hours a day for up to 6 years. This can result in the patient feeling extreme physical discomfort. Studies have found that people who chose the bracing method are also more likely to be in a depressed mood and have a lower quality of life, increased stress, lowered self-esteem, family strife, limitations in physical activity, decreased spinal flexibility, and social anxiety. A huge drawback with bracing is its overall functionality, as in some cases it may not actually work. 20-year-old Costa Rican pro surfer Leilani McGonigal suffers from a severe case of scoliosis, with two major 60-degree curves in her spine. Due to this, she has had to take many approaches to maintain her scoliosis, to allow her to continue her surfing career. In an interview conducted with the author via Instagram, Leilani stated,
I wore my brace from 12 to 16 years old, so 4 years for 20 plus hours a day and then wore it for 1 more year as a night brace. It benefited me in knowing I did everything I could, and gave me and my family peace of mind to be proactive and helped train my posture. Some drawbacks are it was really uncomfortable. I got pressure wounds from my brace and have scars from it. It made me insecure for some time, but I got over it.
since wearing her brace, she is now committed to a strength and flexibility approach, doing methods such as yoga and scruff every day to help her stay healthy. Through Leilani educating herself on her condition and committing to these natural methods, she has avoided any breaks in her surfing and become a pro at a very young age, even competing in qualifying series events while still wearing a brace. Despite knowing whether the brace has actually helped her, she has been able to continue her career and avoided surgery, highlighting the effectiveness of the natural treatment. Lastly, scoliosis surgery is a procedure done to fix the curve of the patient. During scoliosis surgery, your surgeon will use screws and rods to straighten your spine and hold your spine in place until a solid bridge forms. After the surgery is complete, patients can potentially return to surfing after a minimum of 6 months to a year, meaning potentially a season off competing for professional surfers. Scoliosis surgery is designed for more severe cases, often only being done if the curve is greater than 50 degrees and is causing high levels of pain and discomfort for the patient. It aims to stop the curve from progressing or remove the curve as a whole and to reduce breathing problems and diminish spinal deformity. Like other surgeries, there are many potential risks with undergoing the procedure. Some of these include infection, damage to the nerves, loss of blood and/or bowel or bladder problems. If any of these risks are present, a second procedure will have to be undertaken to remove all of the hardware in the patient's spine, removing all progress. Some other risks that may occur include a loss of spinal balance and the possibility that bones won't heal or fuse properly. In many cases as well, the pain after surgery may actually be worse than the pain that was felt prior. The main issue with surgery many surfers find is the lack of control they have if something is to go wrong. However, in severe cases, surgery may prove the best option for the person's overall health. It should also be mentioned that post-surgery, strength and flexibility courses should be done by the patient if they wish to return to surfing and not experience pain. Both Mick and Leilani were urged to undergo scoliosis surgery, and both chose against it. Mick's chiropractor, Chris Prosser, explained to him the potential risk associated, and discussed that he believed Mick could manage his scoliosis by using a solely strength and flexibility approach. So he did this and achieved great success. When Leilani was questioned what made her decide against a surgical approach, she responded,
Surgery is very invasive. It would mean no more competitions for me, and I don't suffer any pain. Also, doing a lot of research and speaking with people who have had it, I found it can cause more pain to them and often doesn't really stop your curve from progressing. I'm not saying I'm against everyone getting surgery. It's life-changing for many in a positive way. However, it shouldn't be pushed as much as it is. I felt really pressured to get surgery, and I'm really glad I didn't.
This response highlights that surgery should only be a last resort for specific cases of scoliosis. The benefits people will get from participating in yoga or other strength and flexibility approaches are much more beneficial than the potential risk with choosing a surgical approach right away. Although scoliosis can have a profound impact on someone, there are many treatments available to ensure that individuals can live a fruitful life. Whether you are a professional athlete or just surf for fun, scoliosis, when treated accordingly, should not limit your ability to succeed, as exemplified by Usain Bolt, Mick Fanning, Kelly Slater, and Tracy McGrady. Battling scoliosis may be difficult. However, with evolving information regarding the treatment options, it is evident that one can reach their full potential, whether that's catching a wave or just staying healthy.